Kate Osborne.
Thank you, Madam Deputy Speaker. I wrote to the Secretary of State this morning before this statement was announced, highlighting a report from the Council of Europe that notes that gender-affirming hormone therapy for trans minors in the UK is almost impossible to access, and that the total withdrawal of access to healthcare outside of a research trial may breach the fundamental ethical principles governing research. These restrictions on puberty blockers removes the clinical expertise from medical decision-making and significantly impacts young trans people and their families. And I'm hugely disappointed to hear the contents of this statement today. So can I ask, will the Secretary of State agree to read this report from the Council of Europe and meet with me as a UK delegate to discuss it?
I'm certainly happy to continue meeting with my honourable friend on this issue. I say with great respect to the Council of Europe and the authors of the report that she references, I have to take decisions about the welfare, well-being and safety of children in this country based on clinical evidence. And when our own Commission on Human Medicines says that there is an unacceptable safety risk and an unsafe prescribing environment, I have to take that seriously. When one of our country's leading paediatricians says there is insufficient evidence about the long-term effects of the use of this particular drug for this particular use, for this particular cohort of children and young people, I have to take that seriously. I know there will be people who will be deeply disappointed by this decision. They will include many trans people and their families, and thinking about some of the young people I've met in recent weeks and months, I have taken to heart what they have said. I know this will be deeply upsetting to them. I do not take that lightly, but I would say to anyone challenging me to do something else, to ask quite sincerely, if they were standing in my shoes as the Secretary of State for Health and Social Care, and they were looking at recommendations from clinicians in our country and the Commission including the Commission on Human Medicines, saying there is insufficient evidence for use of medication in children and young people for this purpose, and that there is an unacceptable safety risk arising from the current prescribing environment, I asked them, would they really be taking a different decision?
Jan Burrow.